Dennis is a family practitioner from Missouri, and he had noted about 4 or 5 months of progressive fatigue, cold intolerance, decreased libido, just not feeling well.
And I went to my doctor and we did a blood test and found out that I was very low in testosterone.
But then he also noted his vision continued to deteriorate, and he was subsequently diagnosed with loss of his peripheral vision on some formal visual testing.
4 months ago I was noticing visual blurring in my left eye. After going to several eye doctors, I had visual fields done, and they showed an abnormality in the superior temporal visual field bilaterally, and that's pretty indicative of a problem in the pituitary area.
He then went on to have an MRI which showed a relatively large pituitary tumor causing a severe compression of his normal pituitary gland and his optic nerves.
As a physician, I have access to a medical library, and I read up as much as I could on pituitary adenomas and tried to find surgeons who excel in that type of surgery. That is what led me to come here with Dr. Kelly.
This was removed through an endonasal endoscopic approach with my colleague Dr. Griffiths. We were able to achieve a complete tumor removal.
My surgery lasted between 4 to 5 hours. I woke up in the recovery room. I was in the hospital for only 2 days. During that time I felt amazingly good for having had essentially brain surgery.
And within a few days of surgery, his vision had improved markedly, and he was feeling much better on appropriate hormone replacement therapy.
My experience here at St. John's is just excellent. It surpassed all my initial expectations. The doctors that have been involved in my care and the hospital have just been super.
He's done very well. He went back to Missouri about 10 days after the surgery.